Hello, everybody. I'm so happy to be here with you and introduce Dr. Pamela Douglas to you, who I've been following since 2016 and who's taught me so much in all her trainings. My name is Merel Obermeijer. I'm a parenting and sleep expert. I work with parents wanting to be the best version of themselves, yet struggling with high expectations, both of their child as of themselves. They are living in a culture where expectations are not aligned with the neurodevelopment of the child. Yet the influence of nurtured care for the development is denied. So, for example, the first question asked at parents with a newborn in Holland is she sleeping through the night yet? Hereby setting unrealistic goals for parents and putting pressure on them. Dr. Pamela Douglas is an Australian GP and researcher with nearly 4 decades of experience working with families. She is a breastfeeding medicine physician and fellow of the Academy of Breastfeeding Medicine. She is also an adjunct associate professor with the School of Nursing and Midwifery at Griffith University and a senior lecturer at the University of Queensland. Over the past 20 years, Dr. Douglas has published the evidence base to her programs, which are known as Neuroprotective Developmental Care, NDC, or the Possum programs. NDC offers a paradigm shift in the way we help families who face breastfeeding, baby sleep, and cry fuss challenges, and is changing the way we approach the first 1,000 days of a child worldwide. Her groundbreaking work is detailed in over 30 international research publications. She is also the author of the best-selling book for parents called The Discontented Little Baby Book. I am thrilled that her book is now translated into Dutch. So, Pamela, thank you so much for being here.
Hello, Merel. It's just so lovely to see you and so lovely to have made this space to talk with you a little about a topic that's so close to your heart, to my heart, and I think to the hearts of the participants with us today. Parents and the sleep of their baby, and how we might work together to take away some of the stress and distress that's so much to the fore at the moment around baby sleep. So it's a real pleasure to be here.
Thank you. So let's dive right in there. So your book presents a new way of caring for babies. What made you challenge traditional methods of handling crying, sleeping, feeding, and what are the most important things you learned from your research?
So what made me challenge the dominant paradigm around infant sleep, which of course is the sleep training approaches? Well, it came out of my years of work as a general practitioner, a family doctor with parents and babies, and seeing the very high levels of distress that families were grappling with in this time. And also seeing in my clinical practice how the sleep training methods, which were really all that was out there for families, were making things worse rather than better, it seemed to me. Also, I have to say, share with you and your delegates today, Merel, that as a very young doctor, I started out actually working with First Nations peoples here in Australia. And so I learned a lot from that very early cross-cultural experience that has informed the rest of my work going onwards. I'd also developed a special interest in breastfeeding and how these domains of sleep, the unsettled baby, breastfeeding, and parental well-being all interacted together. So I then began to dive into the research around baby sleep, and you asked me what were the most important things I found. Well, it certainly became clear, and this has just continued over the years, that it's not clear at all in the research that the sleep training approaches actually improve a baby's sleep at night. It's not at all clear that that the sleep training approaches decrease the frequency of babies' night waking or extend durations of sleep in a way that has any serious clinical significance for families. I also did a dive into some of the cross-cultural or evolutionary biology research to look at mismatches between our environment of evolutionary adaptedness, you might call it, and current cultural approaches to infant care, and then became very interested in some of the early circadian medicine work. It wasn't called circadian medicine back then, and it was really only used with adults. But I began to adapt elements of these research literatures into a program for both education and clinical intervention for families.
Yeah. Yes. So, and in this program you've developed, and we see that also in the book.
Yes.
I work with that also with parents, and I see these parents. It's just a really practical question, this is, but I see these parents, they just want a quick fix. They're just so tired and they're just struggling. And just looking for these quick fixes in the first few months. And how does your method help parents to adapt these more sorry, can't find my words, a more caring, a more long-lasting approach?
Yes.
How would you help with parents for that?
Yes. Yes. So in my book, I give what I hope is a very useful overview, really, and then, of course, in the Possum Sleep program, there's a great deal of detail about how I do this. And let me pull out the important points for you. Firstly, there's a lot of misinformation out there about baby sleep. The simple things like how incredibly variable baby sleep needs are from baby to baby, and how these sleep needs change over the first year of the baby's life, shrink away usually. And then when I'm working with families, we run through all sorts of facts like this about baby sleep. For instance, how it's normal for babies right into toddlerhood, actually, Merel, as you know, to wake every couple of hours at night. We know that from big cohorts of parents that have been studied in the research. It's very developmentally normal. But many families are grappling with what I call excessive night waking, which is waking every half an hour, every hour, 45 minutes as a pattern throughout part of the night for many nights of the week. So, in fact, for some families, there's just a careful education around what normal baby sleep looks like, how normal it is to cuddle, breastfeed our babies off to sleep, how biologically normal feeding to sleep is, and so on. But in other families, we're really needing to work with the circadian clock and the sleep pressure, the two biological sleep regulators, to actually deal with excessive night waking. So there's lots of facts about normal baby sleep that we need to communicate to families, and then also help or an intervention for when that baby is waking excessively, and that family might take a couple of weeks to work with the steps of the sleep program to come out the other side to developmentally normal night waking instead of this terrible experience of excessive night waking. Have I answered the question well enough there?
Yeah,
Just keep me on track, won't you?
Yeah, I will. So yeah, as you mentioned, it might be normal or excessive,
Yes.
what parents and children are experiencing. But what I also see when I work with parents, there might be this hyper focus on the challenges and the problems and the sleep problems, not only from the parents, but also, for example, grandma texting, how did she
Yes.
sleep today? Or mom
Yes.
coming home from work and say, how bad was it today? And this hyper focus on problems just lingering on and changing into how is the eating going when it's a toddler, and it
Yes.
just gives this way of looking at the child as a problem that needs to be fixed. So how can we as professionals help parents change their view and make it a bit more broadened? What would you
Yes.
suggest?
Yes. Yes. So this is where it's so important for us to be educating families about sensory motor nourishment. Excuse me. About how important it is for our little ones to have rich and changing sensory motor nourishment. And I'll describe it like this, Merel. I'll say our little ones are laying down neurological pathways in the first weeks and months of their life in direct response to rich and changing input across all their senses, including their vestibular perception, proprioception, and if a little one is not having her needs for rich and changing sensory motor stimulation met, this often occurs inside our homes because our homes are so low sensory actually relative to the world outside our homes, then our little ones dial up. So the sympathetic nervous system dials up, and I'll unpack what this dial on the sympathetic nervous system is for parents. So we want to keep our little ones dialed down through frequent flexible breastfeeds or feeds if the family's using a bottle, but frequent flexible feeds is one tool, and then the second tool is rich and changing sensory motor nourishment, which means for the primary carer being outside the house, whether it's visiting friends, whether it's parent groups, whether it's getting tasks done at the shops, visiting the primary carer's workplace, being in the natural environment, out on the streets, whatever it is outside the home, brings the world into the baby and dials the baby down. So then we can just take off. I'll talk a lot about taking off the sleep lens and putting on the sensory motor nourishment lens and just enjoying a day that's shaped around the primary carer's needs for, you know, social contact, an enjoyable day outside the home, expecting that little bubby to fit in, or indeed making a day that meets the needs of the older children outside the house, you know, play groups, getting to and from school, soccer class, music class, whatever it is. The baby fits in. Sleep happens on the go. We don't need to be trying to get the baby to sleep. We don't need to be trying to keep baby asleep. Baby might fall off to sleep in the car capsule. We just pick the bubby up and go inside to the school because we've got to pick an older child up, or we've got a coffee date with a friend. If the baby really needs to stay asleep, if the sleep pressure is really that high, the little one will stay asleep anyway. Otherwise, the baby will wake, often a little bit of a cry, sometimes a transitional breastfeed, let's say, if the bub's breastfeeding, but on with the day, rich and changing sensory motor nourishment. And that way, we're able to not worry about sleep, but let sleep look after itself. We can actually trust these biological sleep regulators. if we're using our two tools of rich and changing sensory motor nourishment and frequent and flexible feeds. So that's how I support families in taking off the sleep lens and putting on the lens of making the days as easy and as enjoyable as possible through the use of our two tools. And that then, of course, has very positive implications for the night. It means that we're keeping the circadian clock nicely aligned with parents' circadian clock, so that even though there's developmentally normal night waking, we're not in a situation of excessively fragmented sleep at night or excessive night waking, which really comes about when families are being told to get these huge blocks of sleep during the day. A few weeks down the track, oops, the circadian clocks become really disrupted and the family are waking every half an hour, every hour to an unsettled bubby.
So yeah, I this is so interesting, and this is also so this is really a paradigm shift. So when
Yes.
I work and talk with professionals about this, but also when I first encountered your work, it also asked for me to change my whole view, because in Holland and also Belgium, we are looking at when there's a discontented little baby, we are looking at rest, regularity, rhythm, and
Yes.
a focus on sleep and wakeful windows and things like that.
Yes.
So what could help for professionals to change their view on this? It could be
Yes.
helpful.
Yes. I think there are two things that could be helpful here. Firstly, it's being aware of all the research now that shows how responsiveness to our baby is best for developmental outcomes, but also psychological flexibility is best for our own emotional and mental well-being as parents. So it's looking at the research literature, both from the perspective of the infant and from the parent, that really supports flexibility and responsiveness as being best for families and best for babies' developmental outcomes. So there's that, because even though in recent years, in my experience, there's been more of an effort amongst those who are using the sleep training approaches to talk about responsiveness. And so in Australia, for instance, and I think, in the English speaking world, for example, there's an emphasis on what's called responsive settling, or responsive settling is one of the big phrases that's used a lot, but it's really just another form of the graduated extinction or the first wave behavioural methods, just a little bit more drawn out, and in fact equally disruptive to families, I would propose. So although there's been an attempt to integrate the neuroscience around responsiveness, which is just so clear, we're in a situation that's typical of paradigm shift, aren't we? Where there's some sort of attempts to move towards a new paradigm, but we haven't tipped over. We're in a place of turbulence where we haven't, and confusion, where we haven't tipped over into what the new paradigm needs to be. And I suppose, I have the view that the work I'm offering you and the Possum Sleep program has been there at the vanguard of a new paradigm in terms of infant sleep. So there's that. But then the whole other thing, of course, that in my lifetime we've become more and more aware of is the importance of understanding health challenges or well-being challenges in the context of evolutionary biology, and what the little human, the little new human has expected biologically on arrival in this wonderful world, on this planet, and what might be a clash between the bubby's evolutionary needs and what our culture has been telling us the last couple of, certainly the sleep training approaches came to the fore in the 50s and 60s as part of what was called scientific motherhood, a whole, if you like, scientific paradigm starting to move right over into motherhood in the 50s and 60s, where it was believed that the more we could regulate biology, the more we could control the natural world as manifest in our babies' bodies and needs, the better we were being as mothers, the more scientific we were being as mothers. But now, of course, we know with all the incredible science around evolutionary biology, that actually that's an outdated way of thinking about baby biology. We certainly want approaches that are very appropriate for contemporary 21st century families with all their complexity of family life, multiple responsibilities, paid work responsibilities for both parents, nuclear families where there's less support more broadly from extended families. We want an approach to sleep that works in our very complex contexts, but actually it's so much easier for families if we understand how to work with the baby's biology, with the baby's evolutionary needs. It's actually not harder, even though in the past health professionals have worried it would be harder. It's actually not harder. It's so much easier and more enjoyable for families, even though it's still a challenging, wearying time of life.
And it is quite challenging. So in a way, it's like not swimming upstream, but swimming with the stream, you say, and it's still hard. Yeah. So you, in your book, you also cover, like you mentioned already a little bit, the strain it takes on parents and how to take care of your own emotional well-being, and also using things like mindfulness just to cope with this, and also making your life interesting and sensory. So what would you like to add to that?
Yes, well, it is true that an important part of the Possum sleep program, whether we're looking at babies or toddler sleep actually, is as you say, caring for the parents' emotional and mental well-being. And in fact, you'll see both in my book, the Discontented Little Baby book, and then also in the Possum sleep program, in an expanded way, I integrate acceptance and commitment therapy, which is a very contemporary form of cognitive behavioural therapy that has a growing evidence base to demonstrate its usefulness for parents with babies. I think ACT, it's called ACT, and I think ACT is incredibly powerful actually as a set of really practical psychological strategies. Certainly, for many years now, I've found ACT very helpful for myself and very helpful working with families. And so I've adapted ACT with strategies for the perinatal period. And these are things like how to manage our very busy brains after the birth of a baby, how to make space for the many painful, challenging, or sometimes empty, numb feelings that come after the birth of a baby. How do we relate to all of these powerful emotions that come and go like the weather? How can we practice bringing our attention back into the present moment when we're having such a strong presence of difficult thoughts or difficult feelings? And self-compassion. What are some simple but really powerful techniques around practicing self-compassion through this incredibly challenging and amazing time of life transition with a baby?
Yeah.
So, you know, I can talk more about specific ideas there, Merel, if you'd like me to, but there's a kind of broad brush response anyway. So
Yeah. Yeah. So yeah, we could talk for hours.
we could, we
Think.
could,
Yeah, we could.
we could.
Yeah.
These are topics that I
And
love to talk about.
yeah, me too. So, but for now, we would have to wrap it up. But
Yes.
not. I was thinking if people after they've read your book and if they would like to know a little bit more or read a bit more, where could they go?
Yes. Well, we have possumsleepprogram.com. So that's the website that has the Possum's Baby and Toddler Sleep Program on it. And you'll be able to see, I think, half a dozen of those articles anyway, free. And then we have a membership system. So there's the sleep program. I'd also like to let your participants know about the NDC courses. So neuroprotective developmental care is the kind of provider term for the Possums programs. And in NDC or Possums, we look at how sleep is actually embedded in issues around breastfeeding and feeds, and the bubby who's crying and fussing, and the emotional well-being, and baby's sensory motor needs. So participants in your conference, if they were interested, are able to upskill if they're registered health professionals in the NDC masterclasses or even going on to become NDC accredited. If your participants are providers who aren't formally registered health professionals but offering those important services for parents with babies, like being doulas or sleep coaches, they could also participate in our NDC for providers and educators, with the lovely Bree Cosgrove helping me with that. And there's an overarching website that's just gone live called possumsndc.com that tells you about both the health professional and the parent programs that we have available. There's also, this might be of real interest to your participants too, Merel, because there's Sleep Baby and You, which has been created in a collaboration between myself and Professor Helen Ball in the UK, which was an adaptation of the Possum Sleep program for the UK context. So I'm sorry, still in English, but with some fabulous animations in it that providers can use in their consultations. So some people who are passionate about working with sleep like to use Sleep Baby and You, which is also found on the NDC Institute site, ndcinstitute.com.
Thank you. Yes, so everybody go and have a look over there. So as we wrap it up, if there was just one takeaway you could give people, I know this is a hard one I'm
Yeah,
asking from you.
yeah.
So if you would walk away, people would walk away from this conference and there was one takeaway, what would you suggest?
As providers, I think it's very important that we feel confident to focus on growing joy in that family's life with their baby, with their toddler. That it's more important to grow joy, enjoyment, and delight than to follow the rules. And in fact, the science backs that up. The best thing for our families with babies is to be growing joy.
That's a beautiful takeaway. Thank you. Couldn't agree more. Thank you so much. It's been a delight and wonderful to talk with you. And yeah, wonderful.
Thanks,
Thank you.
Merel. I feel very touched, actually, as I said to you, that you're having this day that's focusing on my book, on my work. I'm so honoured to have it out there in Dutch and and very honoured to have your interest in what I think is a contribution towards paradigm shift in the way we're caring for our families with babies. So thank you, Merel, for all that you're doing. And thank you to every one of your participants for all that they're doing for families on the ground every day.
Thank you. Have a wonderful day.
Thank you. Thank you.